Thank you so much, Dr. Hashmi. Assalamu alaikum, all the participants. Welcome to a general academic session, which we should be thankful to Dr. Hashmi. It was his idea. And if you listen to most of his teaching and preaching, he uses this word quite frequently. He uses the term integrated studying, integrated education. And it is extremely important as young medics for all of you to know what this exactly means. Integration is, if supposing these are different subjects, anatomy, physiology, biochemistry, pathology, forensics, ethics, community medicine. And then integration is when we bring them together and we sort of teach them in a way that what we are teaching is imparting knowledge in all the different disciplines at the same time. That is the simplest definition of integration. Um, and the reason that we are always stressing on integration and studying in an integrated way is because most international exams, thinking of part one exams in USA, in Australia, in UK, even in Malaysia now, these part one, that is basic sciences exams, and even clinical sciences are integrated by design. But the basic sciences exam all over the world, except maybe for countries like Pakistan, are integrated. Somebody's mic is on and everybody can hear what is going on, so that is not nice. Please mute yourself. Um, and the reason we need to have our students study in the integrated way right from the get go is so that they are prepared to appear in international exams at the same time that the international students are prepared to appear in those exams. Now, in Pakistan, unfortunately, or well, I have to say, unfortunately, in Pakistan, the integrated education was introduced back in 1987. The first batch in Aga Khan, and which was actually the fifth batch that entered, was exposed to integrated education in 1987, and the curriculum was designed by a physiologist whose name was Anderson, a brilliant man. I don't know where he is now. And for the first time, I myself had gone from Khyber Medical College to Aga Khan, and I realized that physiology is not about sodium channels, but actually, physiology is about what happens when sodium crosses those channels into the cell or when it crosses the cell through those channels to the outside of the cell. What is the effect on the overall organism? And how this effect can be used to treat patients in a good way, in a better way. So it is not the action potential of the sodium channels that we had to learn and we had to have in our rote memory to reproduce in the exams. We were asked questions about hyponatremia and hypernatremia, hypernatremic dehydration, dangers of managing hypernatremic dehydration incorrectly. So that is what we were exposed, or what I should say, the first batch that was exposed to this kind of a curriculum. And I know this from 1987 because I was there. And that prepared me to face any kind of exam in basic sciences. It's not that I did not know the action potential, and it's not that I did not know what sodium channels and what anions and cations were, but it prepared me a step ahead as well. And that is extremely important, not only for exams. Of course, exams is what we live for, but it's important from the patient management standpoint, from the conceptual understanding of medicine standpoint. So today's session is going to be a short session, and I'm going to leave time at the end when you can ask your own questions. I am going to try and have all the participants to enable them to differentiate different levels of academic integration in medical studies. how to approach the integration. If you are in a system where there is no integration, if you are in a system where physiology is physiology and biochemistry is biochemistry and anatomy is anatomy, and they don't cross over at all, then you need to know what are the different levels of academic medical integration. Then to plan a syllabus for your own studies. To be able to plan a syllabus, bache aapka somebody's mic is on, can you please mute it? Because we can hear the yelling. To plan an integrated syllabus for your own studies. It doesn't, the problem is that maybe you are in a class of 200 or 300 students or 100 students, and all of you are exposed to a non-integrated curriculum. So how can you, being in that class, still study in an integrated fashion? And then alongside the second objective, I'm going to also enable you to address exam questions according to the level of integration in the question. Because I'm going to expose you to examples where a simple physiology question is asked. But the question keeps getting more and more complex as the level of integration increases in that question. So these are simple three objectives, and it's not going to be a long session. But I want you to prepare your questions. I want you to listen attentively, and I want you to ask your questions in the chat box or verbally as you feel easy at the end. So coming to the first objective, different levels of academic integration. First of all, we have the disciplinary studies. The disciplinary study is the student learn the concepts in the same disciplines. Uh, like I said, physiology is physiology and anatomy is anatomy, and anatomy is never physiology, and physiology is never biochemistry. They are all sort of like different disciplines. So that is the disciplinary level at which most Pakistani medical colleges are existing, although an integrated curriculum is now the requirement of Pakistan Medical and Dental Council, and an integrated curriculum is the requirement in UAE and in Saudi Arabia. We know that. But the way the teachers are teaching may be simply disciplinary, while an integrated curriculum is presented at the curriculum meeting or at the as a requirement for that institution. Then is the multidisciplinary. Multidisciplinary is that they learn concepts and skills separately in each discipline. Multidisciplinary is a little better than disciplinary, but multidisciplinary is still very close to what we have in Pakistan, where each subject is a tightly controlled box, and stuff does not diffuse out of the box into another subject. It's never mixes. They just separate boxes, have separate faculties, and have separate exams, and everything is separate. There is interdisciplinary. And this is the beginning of what we call horizontal integration. You will see it. Horizontal integration, and horizontal is like this. So supposing you have columns where you have physiology, anatomy, biochemistry. So you have these columns, and there is an integration across the subjects. So when I'm making a question in physiology, or when I'm teaching a concept in physiology, I also teach the biochemistry behind it. And I will give you an example after this slide. When I'm teaching anatomy, I also give you some physiology of that anatomy that I am teaching. So there is sort of, diffusion and mixing of subjects this way. So it's going this like anatomy, physiology, biochemistry, pathology. This is horizontal integration. Then we have what is the next thing that is coming, which is called transdisciplinary. Transdisciplinary is a very high level of integration. Now, in basic sciences, I have anatomy, physiology, biochemistry, pathology, right? And in year wise, first year, I have basic sciences. Second year, I have basic sciences. Third year, I have pathology, forensic medicine, community medicine. Fourth year, I have clinical, medicine, surgery. So this is a vertical uh, angle that I'm talking to you about. And transdisciplinary is an integration in these subjects. When I'm teaching anatomy, I'm also teaching surgical anatomy. When I'm teaching physiology, I'm also teaching maybe part of endocrinology, and real life patients are being shown to you. When I'm teaching bone metabolism, I'm also teaching rickets in pediatrics. So I have one is a horizontal integration and one is a vertical integration. And transdisciplinary is the one that I mentioned for you, undertaking real world problems or projects. And some of you may be familiar with problem based learning or project based learning. Students apply knowledge and skills from two or more disciplines to solve that problem and to identify that problem in an effective way. So these are and to tell you the truth, in USMLE step one, in PLAB one, in multiple exams, especially from the Western world. I cannot speak for Saudi Medical Council or for the UAE, their institutions, SEHA and all those. I am not familiar with those exams. But Western medical exams, the European Medical Councils, American Medical Association, Australian Medical Association, the basic sciences exam questions are all transdisciplinary. So if you wish to appear in those exams as soon as you clear your final year and as soon as you go through your house job, and also a good news for Pakistani medical students and Indian medical students is that house job is a time to learn the most transdisciplinary medicine. This is where everything comes together. This is where you're applying your basic knowledge as well as the clinical knowledge that you acquired during your fourth and final year. Now, this is the same thing that I mentioned for you, but this is given in a more organized way. The traditional curriculum that most of you are exposed to, separate subjects, separate topics, upper limb is upper limb, and cell physiology, and bioenergetics, the Krebs cycle, and everything are in a separate box that we have to learn, and we have to learn those figures, and we have to know all the enzymes. That is the traditional system. The interdisciplinary or the multidisciplinaries, separate subjects, still separate subjects, but topics are related. So in the beginning of integration is that I begin teaching topics that are common, like respiratory physiology. Then I'm dissecting the thorax. Then I am doing maybe the electron transport chain or the hemoglobin structure in biochemistry. So all these subjects, all these things are sort of getting integrated. And as you can imagine, in the traditional system, if I'm doing the upper limb dissection, in physiology, I am studying ion transport. I'm studying the Gibbs-Donnan equilibrium, and I am studying sodium channels. I'm obsessed with sodium channels, but and in so anatomy and in biochemistry, I am studying I don't know, maybe something totally unrelated, maybe bioenergetics. So something that all these three things are absolutely discrete. But if I bring them together, if I teach, if when you are dissecting the upper limb, I teach you the musculoskeletal physiology in physiology, and the muscle and the calcium and phosphate balance and the bones in biochemistry, there will be some connection among the different things that you are studying, and then is integrated. So subject teachers collaborate to select and plan study of the shared theme. This is the first time the word theme is mentioned here. And a theme is, I will make it clear as we move forward. The theme is actually what we are using to teach all the subjects. The theme, for example, if I say the next month theme is going to be, and I then I say the next month theme is going to be anemia. So anatomy, physiology, biochemistry, all will come together and sit, and they will say, okay, so anatomy or histology needs to do this. And physiology will say, okay, we will cover hematology. And biochemistry will say, okay, we will cover hemoglobin structure and erythropoietin, and we will cover all these subjects that are related to and exist around the theme of anemia. That is, when we have entered integration. We are now into integration. And then finally, the entire curriculum. How does the entire curriculum get integrated? There are no separate subjects. This is a very high level of integration. And I don't expect any medical school to achieve this overnight. This is achieved in at least, when you begin here, when you start here, this stage is achieved at least in 3 years. So this is not something that you can just go and tell your principal, or you can go and tell your teacher, we are going to be integrated tomorrow. We want to be integrated tomorrow. It doesn't work this way. This is a continuum, and the faculty and the institution have to continuously learn how to get integrated and how to work as a team and how to develop themes that cover all the subjects required by the Pakistan Medical and Dental Council, of course. So that is a concept. That's just to give you an idea of how integration works, how easy it is, and then maybe how hard it is. So now, what do you need to do to plan an integrated curriculum for yourself? Okay, so, I'm in a medical school that has no integration. Or, maybe I'm in a medical school that has a very rudimentary level of integration. I'm not satisfied with it because when I look at exams in part one and part two of other countries, I cannot attempt those exams. First and foremost, and this you will not find in a book. I'm sorry, if you want to write these points down, go ahead and write them down. So make sure to make an extensive syllabus. Sit on your laptop, at least have a laptop, stop working on your phones, they're your enemies. Or have a notebook, like I have notebooks all over. I'm so used to writing, you will never find me without a notebook here, you know. So I have a notebook, I have a pen handy, and make sure you write all the topics that you need to cover. Then you allocate study hours to each subject. For example, if I say I'm going to study, I don't know, calcium phosphate metabolism, I need maybe at least 4 hours to study that. Whichever book I'm studying from, I need 4 hours. I tell myself that, Afshan, you need 4 hours to master this subject. So I write 4 hours in front of it. Then divide the total study hours. At the end, you may come up with 300 hours, or I don't know, 800 hours, whatever. Divide those study hours by the number of days that you have to prepare for the exam. It may be 30 days, it may be 20 days, it may be 60 days. I don't know. But the number of days that you have, and the number of days is number of days. The intensity of study can go up and down. Sometimes you have a heavy day and you are, in the hospital and you are very busy, but that you have to make up on the weekend. So you actually divide those hours over the total number of days. Once you have divided it, this is it. This is the number of hours you have to study in a day. And I have been a medical teacher from 2005 to 2018. So I have seen generations of, I mean, my medical students have kids now, they are all my grandkids. I love them. And I have seen so many medical students. I can tell you that more than 70% of you do not study for more than 2 to 3 hours a day. If I look at the entire year, this is what you do. Medical education and medical study is between 5 to 6 hours of study a day. Okay. It may be a day, it may be a night, it may be studying for 10 hours over the weekend, but this is the average that is required in a medical course. Now, the good news is you allocate 2 hour sessions. The human mind, it just goes numb. It becomes saturated, it goes numb. So you need 3 sessions in a day, 2 hours each to cover your stuff, whatever. And then remember to study one thing at a time. Like integration doesn't mean that you have all the books open in front of you. For the 2 hours that you are studying, you're going to study one thing in that time. You're going to study it properly. You're going to take notes. The best way to study, I don't know how many of you know that, the best way to study is to make questions out of what you are studying. The best way to study is to make questions and suitably multiple choice questions out of the material that you are studying. We were taught to do this in our Khan. I remember it was Professor Rayani. May Allah give him a long, useful life. He was in physiology. He taught us this trick. Then you study the easiest subject first. Don't go to the hardest subject. It's going to demotivate you. It's going to discourage you. Go to the easiest subject first and study in a reverse order. So at the end, you are studying the subjects that are the hardest for you. And it is more likely that you will remember them during the exam. And make use of the benefits of study companions. I don't know how many of you, but not many of my students were into, mixed studies or study sessions and stuff like that. I was a combined study person. I was the go-to for everyone who wanted to do combined study. So I would advise the same to everyone who is listening to this. Now I'm going to give you examples. Plan an integrated curriculum for his or herself, for them, for their own studies. And the example is, this is basics because we are talking about part one exams. Okay. Physiology, then maybe physiology and anatomy, physiology, anatomy, biochemistry. Now the integration is becoming real. Physiology, anatomy, biochemistry, pharmacology. You can do that. The reason I have written it here is to show you that you can actually do that. Physiology, anatomy, biochemistry, pharmacology, and pathology. And then also throw in a bit of ethics. Okay. I'll give you examples of each one of them. And you will, when I give you example right now, you must be thinking, what, this old woman is just crazy. But when I give you the examples, you will realize that this is the questions, that you face in exams. This is where they come from. So for example, you are studying bone physiology. You do the important topic identification through from the first aid. It's a famous book, from MCQs and from past papers. These are the three sources. If you go to Google and you type MCQs on bone physiology, it will give you so many sites, it will give you so many MCQs. You don't need to, specifically do something. If you're preparing for a particular exam, that's different. You're preparing for USMLE, you're preparing for the Australian boards or something, that's different. But if you're just studying, maybe if you're studying for your own exam, but you want to study in an integrated way so that that subject is also prepared for a bigger exam. The time to study, maybe you gave yourself 6 hours. And the question is, the most important cell signal in bone regeneration is, now this is a pure physiology question, pure physiology, cell signal, and just have to remember everything. There are osteoclasts and there are osteoblasts, and then there's mesenchymal differentiating factors and so many things. But this is pure physiology. Okay. Now, keep bone physiology in mind, and I will take you through a continuum of increasing complexity of integration. Now I'm a teacher and I want to give you a question in physiology and clinical anatomy. I want to see that this kid knows physiology, but how much relevant clinical anatomy does this kid know? So I'm again, going through all the important sources where I can find questions. The time to study remains 6 hours. It doesn't change. The example of a question is the commonest fracture in old age is. This is a clinical question. This is a skeletal question. This is an epidemiologic question. This is a community medicine related question. Of course, this is a physiology and anatomy related question. And I've sort of given you an example of, we know that it's the hip fracture, it's the fracture neck of the femur, but the question has more than one subjects in it. Okay. Now I want to do physiology, anatomy, and biochemistry. And I am in bone physiology. Okay. I'll give you a case of primary hyperparathyroidism with a pathologic fracture. And through the case of primary hyperparathyroidism, I will teach you nervous system, digestive system, musculoskeletal system, and urinary system. I will teach you all of this through this one disease. I'm not just teaching you what happens to calcium and phosphate once they go into the bloodstream. I will teach you how to recognize primary hyperparathyroidism in a patient who comes to you with a pathologic fracture. Okay. And you're still a first year student or a second year student, but I can teach you all this with just one case. And in fact, you will be awake through that class. You will not go to sleep, right? Okay. Now I decide that, okay, so my basic sciences are completely integrated. My basic sciences are, physiology, anatomy, biochemistry is all, they're all married to each other. But I also want to add pharmacology. I'm now going into vertical integration. Okay. So I add pharmacology to the overall subject that I'm going to teach. Physiology, anatomy, biochemistry, and of course, pharmacology. Bone physiology and anatomy. And then again, you go to your first aid and MCQs and past papers. Time to study has slightly gone up because now you are going to be studying topics from your pharmacology book. Who knows? I don't know which book you study, but whichever book you study, you're going to be studying calcium metabolism and some drugs and maybe vitamin D and phosphate in that text. And the theme or the question that I'm going to give you in the exam as an example of this integration is a postmenopausal woman presents with multiple bone and joint pains for the last 3 months. Her treatment of choice is. So postmenopausal, bone pains and aches and pains. Then I'm asking for a treatment. And there is so much that you can review right here. What are the changes that happen in menopause? What happens to osteocytes? What happens to osteoblasts and osteoclasts? What happens, what is remodeling? What happens in teeth of postmenopausal women? What kind of tissue is lost and how we can uh, recover that. What are the current pharmacologic interventions to repair this kind of damage? And at the heart of everything is estrogen deficiency that has nothing to do with anatomy, physiology, and biochemistry by itself. That is a subject in itself. So I will teach you the case of a postmenopausal woman, or I will ask you a question about a postmenopausal woman having bone pains, and I will be assessing your knowledge of all these subjects. Okay? And of course, pathology, which is the king subject. Pathophysiology. Medicine is actually 80% pathophysiology. Everything else comes after that. So if you know your pathophysiology, if you know what is right and what went wrong, That is it. You will know how to treat, you will know how to repair, you will know where to refer, you will know what to do with the patient if you know the pathophysiology and you can identify it. So now I have added pathology, and the question is going to get really complex. And many part one questions, and I should say USMLE step one questions, are in this pattern. There is evidence of bone regrowth in the radiographs given here. These are the two radiographs. What is the most likely gender, age, and condition of this patient? This is a female, this is postmenopausal, and she's suffering from osteoporosis. What treatment did she receive that led to bone regeneration? So this is the pre-treatment and this is the post-treatment. It says vitamin D here. But of course, it will not say that in the question. And this is the question that you are given, and this is the question that you should be able to answer if you are to compete in these exams against students who come from an integrated system. Now I become really evil, and I know how medical teachers, how evil they can be, and I throw in a bit of ethics. And I say that they know everything. So I'm now going to test them from the ethics standpoint. Teacher will teach a case of breast cancer in a middle-aged woman, and this is the use of bisphosphonates in you know in breast cancer. And the yellow is an indirect effect, and the green is direct effect of bisphosphonates. And I am trying to justify treatment of a cancer patients with bisphosphonates. I'm not teaching you the subject. I'm just giving you an example. Okay. So this is to show you that not only horizontal integration, the questions have vertical integration. The question is not going to ask you, what happens in a bone where there is metastasis. The question doesn't care about that. Question is going to ask you, do you know the physiology of a bone that is infiltrated by cancer? What are the biochemical changes? What are the possible treatments for that bone pain? And what does the bone or what does the tissue actually look like? What is wrong with it? You know, so the question then is addressing so many topics at the same time. And I know this has now gotten to be overwhelming. Now you must be thinking this woman is crazy. Nobody can study like that. What she is asking for is not possible, but it is entirely possible. It is entirely possible to do. There is nothing impossible in it in this day and age, when all the books are available, when all everything is available on YouTube, when there are so many study tutorials, when there is so much drive towards problem based learning, towards project based learning. Nothing is impossible. So before, this is just to show you, if this is how we make the curriculum. This is just to give you an idea. How do we come up with such complex questions? You know, the thing is that there are three things that we want to teach medical students. When you look at a question, you should know they're testing an attitude, they're testing your ability to recognize a problem, or they're testing you for skills. These are the three things. Entire medical education. These are the three things. And what you see here in first year, normal structure, function, and we are teaching you normal structure, function, and behavior. Year 2 and 3, abnormal, we're teaching you pathology. And year 4 and 5, we are teaching you clinical practice. These are the phases that you go through. And basically, we want you to know clinical methods. We want you to know prevention, which means health promotion. And we want you to know ethics. So this is the modern medical curriculum according to which all exams and all questions are made. If you are ready to, if you are able to study in this manner, taking the exam will be just like taking a college exam. Okay, so I'm going to go to the chat box now. I think this was my last slide, and I have 8 or 9 comments. So I'm going over 9 comments here. Okay, so Sahar says 100%. Thank you. Message being given is not only for medical student, but it is for all doctors, no matter what stage of career. Integration is the core of any learning and problem solving. So, Dr. Hashmi, 100%. That is exactly what was the point of this lecture. That knowing the entire thing is, it's like, it's like Islam. If we know how to pray and how to fast, and how to go to Hajj and how to give zakat, but we don't know that we have to tell the truth 100% of the times, and we are lying. The rest of the things that we are doing actually are not benefiting anyone, including ourselves. So that is, knowing the whole thing, knowing the whole truth. Integration is the core of any learning. Okay. So then there is a question, what to do when you are just so numb and dead after rhythm being broken for a month and you feel so guilty that you just don't want to study. Okay. Now, I am a specialist in this area. The thing is that if you feel that you have wasted too much time, my advice is to go ahead and waste 1 or 2 more days. I'm not kidding. This is actually research. This is actually studied very well. Go ahead and waste 1 or 2 more days and just have a blast. Just waste it in the worst way possible. Go to sleep, go out to a picnic, go watch a movie, go do something stupid. And that guilt will drive you to study at least 30 to 40% higher efficiency. So, but the thing is that the rhythm being broken is nothing. Life doesn't have this kind of a rhythm. Life is not rhythmic, okay? Life is really quickly switching. Life is not, like is not flowing like this. Life has a rhythm of its own, and we have to be used to that rhythm. The greatest motivation is knowing that you are doing this for your patients. The greatest motivation that I found is always knowing that I'm doing this for my patients, and that would bring me back right to my writing table. So prepare yourself for a marathon race, okay? Let's do 100, 200-meter race, specific exam oriented pool or tricks. Very good. Exactly. Thank you, Dr. Hashmi. The thing is, don't expect yourself to be able to attempt a 400 page thing the first day or the first week. Just little bit, every little bit counts. Okay, this the learning is actually experiential. The integrated model that we have in education is experiential, and every experience builds on its own, and it will benefit in the long run, inshallah. As a final year medical student with a schedule of college lectures and ward times, how can I study this way? Final year medical student, college lecture. Bache, final year to is very easy. Uh, Final year, you have diseases. So you're already in that theme. Supposing you are studying TB, tuberculosis, make sure to go through the histology of tuberculosis, the pathologic specimens of tuberculosis. Don't just, just rote memory of the presenting signs and symptoms, and what does the X-ray look like. Of course, those are all important, but go back and revisit the community medicine, the histology, the pathology of this disease, whichever disease you are dealing with, whichever disease. MI, myocardial infarction, go back and study how a plaque is formed. Go back, look at the papers. Where did this knowledge come from? Where was the cholesterol myth born? There is no limit actually to the depth in which you can study one topic. And I know once again you're going to say, I don't have time, but like I showed you, the amount of hours of study time don't go up. Just the amount of subtopics goes up that you are studying in that time. Okay, and the integrated way will investment, very good. Invest more time, exactly. Thank you so much. Thank you, Dr. Hashmi, that, this is independent study, and somebody said that I can dedicate about 3 hours on such independent study? Absolutely. 2 to 3 hours a day is enough. 2 to 3 hours a day means 20 to 30 hours in 10 days. And it's actually going to be close to 80 or 90 hours in a month. We don't need more than that. This message being given is only, okay, so again, integration, and then why it seems difficult to digest the integration, why it takes more time, like only 1 unit in one day, consecutive 2 to 3 units are completed as exams are near. The reason it seems so difficult to digest is because you're not used to it. This is not how we study. We are, all my time in Pakistan, I have even presented in front of Pakistan Medical and Dental Council. I have presented a curriculum called research based education. And before me, my seniors, Professor Tariq Mufti, Professor D.S. Akram, Duris Amin Akram from Karachi, may Allah give them long beneficial lives, both of them had come with community oriented medical education. It was called COME. The medical teachers opposed it so vehemently, both COME and research based education, RBE. We fought so hard, and both of these were integrated. But starting from 1990s down to when I left Pakistan in 2022, PMDC would accept it, but the medical faculties would not accept it. But that's a political debate, no need to go there. The problem, bache, is that you are not made to think like that. And we are trying to make you think like that. It is not difficult. And we have finally started working at individual level because at institutional level, the faculties are not ready to accept it. Thank you so much, ma'am. Most welcome. How do clinicals with USMLE prep, like everyone says, just study, don't do anything in this bit? This is absolutely, I'm sorry, whoever has asked the question, thank you so much for asking. But how to do clinicals with USMLE prep? I was in my internship when I prepared for USMLE. Please, there is no concept of sitting at home and studying. People become depressed, married people become pregnant. God knows, their life just goes down the tubes. And they're sitting at home for 2 or 3 years and they're studying. That is not what USMLE is about. Just, all through your medical career, study the way that we are teaching you to study. Prepare for step one. Give your step one in fourth year, final year. Give your step two immediately after final year or immediately after your house job. Take an easy house job. Okay. How much time? हाँ, आ गया question. How much time should be given for step one when in house job? Minimum hours. Like I told you, bache. House job or no house job, the amount of time required for medical studies, all 5 years, and after that, postgraduate, anywhere from 4 to 6 hours a day. Okay, it doesn't go anywhere. Now, in house job, we beg students to study the diseases that they see. We beg students, Bache, you just saw diphtheria. Go and read it. Go and read it for God's sake. The stupid Instagram that you are looking at in your mobile phone, open Google and check the disease. Check what textbooks are saying about it. Check up to date. Check medlinks. Check whatever is available to you. Because when you are looking at the patient and you study the pathology and the pharmacology, you will never forget it. If you see a patient being managed, if you see a code, and if you see people giving normal saline, and if you see people giving adrenaline, you will never forget these things because that is the most intense learning. That is and we waste that time. We waste that time, not paying attention, scrolling on our phones, talking bad things about the system and the teachers and everybody else, including the patients. Don't waste time. Don't waste time. For integration, need multiple books, looked a single topic, past exam, we need to read UHS curriculum again and again to pass the exam. But yeah, I don't know what is UHS. Maybe UHS must be a good thing. I think it's in Punjab, and they have a good curriculum. They don't have a bad curriculum. I think if you do that curriculum properly, It is the same as studying in an integrated way. Passing exam is nothing very good. Real core knowledge should be your goal. Success will follow you, inshallah. Ed J, house job is mandatory. Say exactly. Thank you, Dr. Hashmi. Please, house job is mandatory. Okay, and okay, I will not say what is the UHS according to Dr. Hashmi, but yeah, it is the University of Health Sciences of Punjab. Okay. So that was all for me. And thank you. I mean, these are really stimulating questions. And I hope that I was able to share some of what I learned as a medical teacher, starting back when I was a medical student. And I'm very proud always to tell students that, I was in the first batch that was exposed to an integrated problem-based curriculum in Pakistan, and that has always stayed with me. That has always stayed with me. So most welcome, yeah. And I over to Dr. Hashmi for your interesting comments.
Madam, first of all, we are very lucky to catch you finally because I was trying to catch you for a long time and I was not able to catch you. So we are very lucky to finally catch you, and it's been an honor for all of us to have you on board. This is one thing. A number of questions you have already answered. I will just add few words that actually, because a number of people who are attending this discussion are not only medical students, so they are already in the career in their already they are in practice. And even for example, like anesthesia is one of the subject in which integration is there in every subject, but in anesthesia, because the domain for us is so broad. Okay, so I think that made me crazy. Now in years of 20 years of my experience in anesthesia, now I have realized what integrated medicine is, because in anesthesia you need to know each hell of knowledge. Okay, so that may be
Yes.
an impulse, because when I was in a medical school, I have no idea what my integrated medicine is. Yes, one of the impulse for us was, he's an international figure, his name is Dr. Najib. Dr. Najib, maybe you have heard about him.
Yeah. Yeah.
He teaches integrated
Yeah.
medicine,
Yeah.
but only that person was the one who used to go into the cells of liver. If he is teaching hepatitis, he will be starting from physiology and then integrating everything. But of course, we were all exam oriented, and this does not give us any vision. Anyways, so
Yeah.
my message and the effort which we are trying to do is not only for medical students, for everyone preparing for any exam. Try to integrate the things. If you are able to integrate all the required material, because if you are just trying to learn any subject in isolation, the result will not be as good as you are trying to have integration with the other subjects. So that's what your message was all the way.
Yeah.
Okay. And why we face problem? Because
Yeah.
as you mentioned, we are not in habit. Nobody encourages. The people around us only give us notes. Oh, take this notes, or take this pool. This is the shortcut. Okay, so unfortunately, integrated medicine is opposite to shortcuts. Okay, and
Yeah.
I will just give this message, that be a doctor who can treat their own family members. Okay, because you are treating someone's mother, someone's father, someone's brother. So don't make a liability for other people, because if you are not confident to treat your own mother, okay, it means your knowledge has deficiencies. So learn the knowledge in the way as if you are confident to treat your own mother, or your own father. That will give you the real picture of how we are required to be as a doctor. So this is what message I want to give to
Absolutely.
all of you. We have
Excellent. Excellent.
another person. I would like to have few words. Dr. Afsha, Dr. Lukman, would you like to say something, please?
Thank you very much. I was, for this opportunity to attend Dr. Afshan's lecture, and it was a good opportunity for me, to remember my day as a medical student. And Dr. Hashmi, you have done an amazing job to bring Dr. Afshan on this forum. I was just thinking about Harrison. When I was a medical student, I used to study from Harrison, and Harrison was obviously a huge, voluminous work. But if you see that text, you will find the same principles which Dr. Afshan was, trying to elucidate here. That it starts with anatomy, physiology, pharmacology. It's all within one cover. People think it's a very big text, but it isn't. It's basically it's just the same. It's voluminous simply because it's it includes the anatomy, physiology, pharmacology, and I think Dr. Afshan will agree on that. That many of the big texts in medicine, they're all integrating right from this A to
Yeah.
Z, the
Yeah.
concept of the disease. I still remember those from my days as a student, and that's how it was. It's wonderful to hear Dr. Afshan's lecture and Dr. Hashmi for your efforts that you are doing to bring these ideas on proper forums. And for all the participants, it's amazing that they are listening and they are looking at the slides. And I'm sure they should, and I hope they benefit from today's lecture. Wonderful, wonderful, wonderful to be here.
Thank you.
Thank you. Thank you.
Inshallah. Inshallah.
Yeah.
All thanks
Thank
to
you.
Dr. Hashmi.
Yeah,
Yeah,
ma'am.
absolutely. All salutes to him.
Actually,
Thank you.
yeah, yes. Thank you, Dr. Lukman sir. Actually, ma'am, we will just request you to have some session with reference to your efforts about research. Okay. Not all of us have any like about your institute of Spire, and you what the
Mhm.
efforts which you are doing with reference to research. Okay, because actually research is the one which not everyone is good at. So I think this if you can give some time with reference to research methodology or anything with what you are doing. And actually the problem, you know what's the problem? The problem is that not everyone will be at the same level and same
Yeah.
opportunities. So we have to make some like tricks how anyone everyone can do some research work or have some pure research work, not the cooked research work at their
Mm.
workplace, whether they are medical students or whether they are residents or even the lazy consultants like me. I have not I'm very lacking in this part of my CV is blank. So so I think if you can just attend the problem which of any stage of their career, like right from medical students up to lazy consultants like me, what they can do.
Sure. Inshallah, I think we can have weekly sessions. This is a good time for me, except when my granddaughter is awake. So then it's not a good time for me. But generally, I think this time works, and we can have weekly sessions. The one design that everybody needs to learn, and that is actually the basis of SPIRE philosophy as well, is to perform audits, and audits do not require IRB clearance. So, the biggest problem that Spire ran into when we asked people to come forward for research was people saying that our IRB is not allowing, our IRB is not permitting us to do it. And that is okay. I mean, we have nothing against IRBs. But the way we got around the problem is that now we offer that we will help you learn about audits, and audits are exactly according to the, SPIRE is basically social action for progressive innovation, research, and education. And that is the best action that you can take, is to perform an audit in your surroundings, on your students, on your patients, on your staff, and to give an idea about how to improve that situation. So I will be very happy to do that. I think it's a 6 or 8 session series. So it can be done in 6 to 8 weeks if we have weekly sessions and everybody does their homework. It can be done, inshallah.
Okay, ma'am, that will be great. Okay, so I just thanks all of the participants to join us and honor us, and inshallah we hope to continue these discussions. Thank you, ma'am. Thank you, all of
Inshallah.
you. Bye
Thank you.
bye.
Thank you. Assalamu alaikum.
Wa alaikum assalam.